How's it going, guys? So we have a very difficult question for immunology / pediatrics. A very similar question shows up on the free 120 for step one. Stupid fucking question, but it's not my opinion. I'll tell you exactly what you need to know, not waste our time. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. Really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. The link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the question. 5-year-old girl, 2-day history of headache and fever, recurrent otitis media and urinary tract infections, as well as skin infections caused by Staph aureus and Candida. Laboratory studies show a delay of segmented neutrophil bactericidal activity against Staph aureus with marked impairment against Candida. She most likely has homozygous mutations coding for which the following. This means she has an autosomal recessive disorder. So let's just look at our answer choices here. Choice A, CD40 ligand, wrong fucking answer. This refers to hyper IgM syndrome. What the USMLE will do for hyper IgM syndrome is give you a big fucking paragraph of some nebulous immunodeficiency presentation. You'll say, don't know what's going on here. And then they'll show you the IgM is super elevated and the other immunoglobulins are low. And you'll say, well, okay, well, obviously this is hyper IgM syndrome. Then the answer will be deficiency of CD40 ligand. So they like the mechanism for this. CD40 ligand is on the surface of Th2, CD4 plus T cells. It binds to CD40 receptor on B cells, which enables isotype class switching so that IgM can switch to the other immunoglobulin types such as IgG, IgE, etc. Wrong fucking answer. Choice B, LFA1CD18 integrin, wrong answer. This is leukocyte adhesion deficiency. This is going to be inability for leukocytes to diapedese to leave the vessels. There's two factoids you need to know for USMLE. The first is the very buzzy delayed separation of the umbilical cord at birth. Many students rely on that as a crutch to get LAD questions, but you need to know, very high yield, that they're only going to mention that about 50% of the time. You need to know that there's a deficient / absent pus at sites of infection. Okay, so let's say absent pus in the skin. Okay, very, very important you know that latter detail. Wrong fucking answer. Choice C, myeloperoxidase deficiency is the correct answer. Now look, what USMLE wants you to know, mechanistically very high yield, is that inability to produce hydroxide halide radicals, bleach, okay, inability to convert hydrogen peroxide to hypochlorous acid. I've seen that on NBME questions as well. So they love the mechanism for this as starters. Then you need to know the presentation. Usually patients are asymptomatic, okay? That's high yield, but the presentation, classically a combo of Staph aureus and Candida, all right? Now, it's not that the condition is limited to these organisms, it's just a buzzy combination, Staph aureus and Candida, and it's autosomal recessive, okay? We've got a girl here, autosomal recessive, we make note of that, because in contrast, NADPH oxidase deficiency causing chronic granulomatous disease, 70% of the time this is X-linked recessive. Now you say once again, well, that doesn't mean it couldn't be autosomal recessive. According to the literature, if NADPH oxidase deficiency presents as autosomal recessive, it's usually older and later in presentation. Okay, that's according to the literature. So we have a child here, which would make it more likely to be X-linked recessive variant if it were CGD. Okay, because we can get Staph aureus and candidal infections in NADPH oxidase deficiency. So that detail about the genetics is important. Now look, on the free 120 question, they don't list NADPH oxidase as a separate answer choice. Okay, the answer is just simply myeloperoxidase. So there isn't that ambiguity, but I articulate this nevertheless because if you were to get a nearly identical question on your real USMLE and they did list both side by side, because MPO deficiency is the answer on the free 120, I would go with that. Okay, so know that this presentation is MPO deficiency. But NADPH oxidase, you need to know that CGD, you can get serratia sepsis. They like serratia, recurrent staph infections. Spaces is the mnemonic for catalase positive organisms. So staph, Pseudomonas aspergillus, Candida E. coli, serratia, okay? But that this presentation here is MPO, autosomal recessive, okay? Choice E, tyrosine kinase, could refer to Bruton, which is going to be a boy who has bacterial infections only. 14 out of 15 questions will be from the age of 6 months onward, so 5 to 7 months-ish onward. Absent lymph nodes / tonsillar tissue or scanty lymph nodes, tonsils. One question I've seen, I say 1 out of 15, where they said bacterial infections from birth. Okay. But bacterial infections only, because if we had SCID, which is classic severe combined immunodeficiency, which is classically the one from birth, they'll tell you a myriad of different types of organisms like viral, fungal, protozoal, and bacterial, not just bacterial alone. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe my channel, and I appreciate your time. That's it.